The controversial National Health Insurance Scheme, NHI, set to feature in discussions at the ANC's elective conference next month. The governing party believes that the NHI will boost quality and affordable health care for all. But of course, critics say that the principles upon which NHI is built need to be reviewed. For more on this, we're joined this morning by Cosatu's Parliamentary Coordinator, Matthew Parks. Matthew, always great to see you. Thanks very much for coming on so early on a Wednesday morning. It's a laudable idea, isn't it? This idea of NHI providing quality and affordable healthcare across the board. But we have what it takes in this country already for quality and affordable healthcare. I mean, our healthcare budget over the past year was 250 billion rand. It's not nothing.
Yeah. Look, good morning. Look, so you're right, we have the resources, we have the capacity, but we need to make sure we spend those resources and allocate them correctly to cover everybody. Because right now we still have a very unequal health system. So we have an overstretched public healthcare infrastructure, like you said, which provides about R250 billion worth of resources, which caters for about 84% of society. And we know it's stretched, it's bursting at the seams. That if you go to a day hospital in Heidelberg, you must queue from about 4 in the morning, maybe be at 4 p.m. You may go to a Hanover Park Day Hospital, and you're at risk of gang fire hitting you as you leave the premises. So it's a real problem. And of course, if we have one nurse filling the jobs of 2 or 3 nurses, if you have a doctor working 40-hour shifts, then it's going to have an impact in terms of the quality. At the same time, you have got a world-class private healthcare institution, excellent healthcare, there's no queues, etc. A similar amount of money spent on it, and it provides for about 16% of the population who can manage to afford medical aid. So they get quality healthcare, and that's fantastic. But at the same time, many of those medical aid members can no longer afford the premiums. The premiums monthly are really suffocating public servants, middle-class workers, etc., who just simply are struggling to afford it. So we have a problem. Both sides are having a problem, both the private and the public healthcare. We need to do something because there's real consequences. If you don't have a proper healthcare infrastructure which cares for everybody, which provides quality healthcare, then people will pay for their lives. People will die of preventable diseases. It has an impact upon the economy because workers are sick when they could have been easily cured, being productive, etc. It means families lose breadwinners who could have been working but are no longer able to work. So we have to do something. We think the national health insurance, based upon the model we've seen in Sweden and other parts of Europe, it can provide a useful platform for us to do that.
So Matthew, you're saying that Cosatu is on board with NHI?
No, 100% on board. In fact, Cosatu and its affiliates, especially our affiliates who work in the healthcare sector, because we have affiliates like Nahau, Genosa, Samatu, who organize health workers, nurses, doctors, even paramedics as well, have long been saying the healthcare institution in this country is in a crisis.
Yeah. We
can't afford to be having patients queuing for hours at a time just to get basic health care. We're spending, as you said, a huge amount of money, but we're not always allocating the resources correctly. And I think perhaps if we just take a step back to 2020, we saw the value of investing in a proper healthcare infrastructure because that time we saw with the pandemic, we were buckling at the seams. We had nurses who were having to treat patients in the parking lots and having to choose which patients they think can survive, which one is unlikely to survive, and to play God in effect. When they don't want to do that, they want to take care of everybody, no matter what the chances of them of surviving are. So it is a real problem. And we also should be saying to ourselves, with all of our resources in South Africa, is it correct for us to be a TB capital of the world, in Cape Town, for example? If it shows our system is not working properly, we need to do something. And we're not just creating slogans here. There are many examples we can point to, be it in Scandinavia, be it in Canada, Singapore, many other countries, who have piloted different variations of a national health insurance, which caters for people, which is affordable for people, for society, which makes sure there's quality healthcare. So it's not going to be an overnight trip. It's not going to be a simple passing a bill at Parliament and then it's done. I think this will be easily a 10-year journey until 2030. The NHI bill is before the National Assembly now. Once it's passed by, say, the end of next year, there would be a supplementary bills, supplementary issues, probably about 10 of them or so, and that'll take us a good couple of years. You also have to allocate resources as government. You've got to kind of see how do you complement and bring together the public and the private healthcare institutions, which will still exist, but they will now need to collaborate and work together.
Yeah, I mean, no one can disagree with the issues that you've just outlined, Matthew, the gaps that are in our public healthcare system. The question, and I suppose the criticism that will come from various quarters, given our experience in our health department as it is, and how funds are it's not only about funds being poorly allocated, but how the health budget is plundered. It doesn't give you a lot of faith that NHI is going to be any better or solve any of the issues that you've just outlined.
Yeah. So it's going to be a difficult journey, definitely. I think there are going to be mistakes, there are going to be teething problems, without a doubt. This is a mammoth task. In many other countries, when they've undergone such projects, it has been a real journey. Even in the United States, when they did the Obamacare about 10 years ago, it was a significant journey. But it's worth it because at the end of the day, you will see the positive results. So you're right, the funding issue is not going to be sufficient. That's why there are proposals at Parliament to say, how do you generate additional revenue? How do you combine resources? You might need to say, for example, what taxes can we do away with? What taxes do we need to look at to fund it? Because these things cost money. Healthcare products are expensive. We also have to have a conversation about the local manufacturing of many of our healthcare products, from the linen to the bedding, the machinery, the medicines, which we should be producing locally at a more affordable cost to the fiscus and to the institutions than simply importing. So that's also a way to help create jobs and revenue for the state. But we also have to say, how do we manage state resources much better? Because the state has been quite abysmal at times in managing resources. So in the NHI bill, for example, there is a specific unit which is meant to be focused when it's established on that precise issue, on wasteful expenditure, on corruption, because it's going to be a significant budget item. And we have to make sure at times we minimize corruption, wasteful expenditure, because otherwise, if we don't do that, public will lose faith in us.
Yeah. People will say NHI is merely just another opportunity for more corruption, Matthew. The issue of checks and balances surely has to be a huge one going into this. Putting independent people in place to ensure that the money goes where it's intended to go.
No, it has to be. We've seen in South Africa a real consequence of state capture and corruption in the past decade. And what the impact upon society, upon workers or patients is massive. We can't underestimate it. So in the bill, for example, they do have an independent board which will consist of people from government, people from outside, medical experts, to give some oversight. We will have this kind of auditing oversight institution in the NHI, which would look at how money is spent, identify corruption and so forth. But even beyond that, we have to see the National Prosecuting Authority being fully empowered. Its vacancies need to be filled. It needs to be given the resources to tackle serious crimes like this. The SAU needs to be given more support, and they have been beginning to pick up some steam, because you can see on a daily basis arrests, people being charged, assets being frozen. We need to have a real conversation about the police service as well, the foot soldiers in the fight against crime, because we can't be surprised when crime or corruption increase, yet we've allowed the police headcount to decrease from about 208,000 in 2010 to 172,000 today, when most police stations are under-resourced, many police vehicles don't work. But again, there is positive progress too. If you look at what the South African Revenue Service has been doing under the new commissioner, when you put in place proper management, you invest in employing additional staff, filling vacancies which are critical, investing in the capacity, the IT systems, it can begin to tackle corruption. So we need to get all these key law enforcement institutions to work together to give support, to say, let's keep a close eye on NHI. Because you're right, we can't afford to be complacent. We all thought the UIF systems were sound in 2020. And so the AG started saying, but there are funny things happening here.
Yeah,
what are you going to do? And clearly there is gaps in the system. So we need to be very vigilant. And it also means that the media, NGOs, everybody needs to be very vigilant as well.
Yeah, certainly a number of issues to discuss insofar as NHI is concerned. The controversial scheme also set to feature in discussions at the ANC's elective conference next month. Matthew Parks, as always, thanks very much indeed for weighing in.